All right, so as far as other really cool big words go in the biliary tree, cholangiocarcinoma is another one of them. Cholangiocarcinoma is not something that you're probably going to see very often. It is a pretty rare disease. It is cancer of the bile ducts, but we do need to recognize where it pops up. It has different names based on where it is located, and then we want to know what leads to developing cholangiocarcinoma as well. The definition of cholangiocarcinoma then is it is a primary cancer that arises from the large bile duct, so that's going to be the common hepatic duct and the common bile duct, and then it gets named for where it is located in the biliary tree. So if it is intrahepatic, that's going to be within the liver, it's going to be arising more from the common hepatic duct. And then Hilar, which also has another name as Klatskin's tumor, that's going to be right at the porta hepatis, and then distal cholangiocarcinoma is cancer arising from anywhere outside of the liver within the bile duct system. First look at this incidence piece. It might feel a little overwhelming, a little confusing, but I want to stop for a second and kind of explain a way to kind of look at how people develop or are more likely to develop certain cancers. So when we talked about the liver, we talked about cirrhosis, and hepatitis C can lead to fibrosis, and that's that rebuilding and healing portion of the liver, and that can lead to cancer. Well, the same idea is true for cholangiocarcinoma. People who are more likely to develop cholangiocarcinoma have most likely gone through something that has caused damage to the bile ducts, and then it starts to heal on itself. And maybe it's a recurring thing, but it's through that healing process that the cells just don't come back quite the way that they were, and sometimes that can develop into a cancer. So the incidence rate on cholangiocarcinoma, we're going to see this commonly with sclerosing cholangitis. So remember, sclerosing cholangitis is inflammation of the bile duct. The sclerosing part means that it is going to become more fibrous and kind of like scar tissue. And then we also see cholangiocarcinoma in patients that live in tropical climates, and that's because these patients are more likely to have infections that affect their bile ducts. So remember, we had Ascaris, again the cholangitis as well. So anything that causes damage to the bile duct walls and then causes it to kind of go through this healing process, they're going to more likely develop cholangiocarcinoma. Then lastly, we more commonly see this in men. Now, when we speak of cancer, we want to think of a primary cancer being originating within the organ that we are talking about. Secondary cancer then is typically referring to some sort of metastatic disease to that organ. So primary cholangiocarcinoma, which is cancer that develops directly in the bile ducts, is actually really, really rare. It is more likely to be metastatic into the bile ducts versus primarily developing in the bile ducts. So that's that first part under primary. If primary cholangiocarcinoma develops, then it is actually the second most common primary cancer of the liver. And going back to if anything causes organs to kind of get damaged and then they heal themselves, as we see with hepatitis C and cirrhosis, that can cause an impact on the biliary tree, therefore increasing that patient's risk for developing cholangiocarcinoma. So out of all of this, I just want to describe everything that you're kind of reading here, but what I really want you to take from this is that sclerosing cholangitis and infections are more likely to cause cholangiocarcinoma. Let's take a look at what it looks like on ultrasound then. So here we have a picture of intrahepatic cholangiocarcinoma. It is a little tricky to see, but it is a soft tissue mass that develops within the bile ducts. As that mass develops, you're most likely going to have obstruction occur, and we know that proximal to the obstruction, we'll start to see dilation of the ducts. As we move towards the porta hepatis, we will develop a hilar cholangiocarcinoma. Remember that hilar cholangiocarcinoma is also known as Klatskin's tumor. Again, boards love anything that has a second name. So Klatskin's tumor are actually a little bit more common than the other two. And what we'll see is a very poorly defined soft tissue area right at the porta hepatis with ductal dilation proximal to it. So again, that ductal dilation is going to be a really big key for finding pathology in the bile ducts. The last variant then is the distal cholangiocarcinoma, and remember that that is any cholangiocarcinoma that develops outside of the liver within the bile duct. And so this yellow area here is pointing to that distal cholangiocarcinoma. It's just kind of a low level gray that's filling the bile duct, but our big sign here is that we have large dilated ducts proximal to that obstruction.